Hello everyone, and welcome to Foundations for Health, where we're going to explore all the small aspects that one can do to empower us so that we can move our lives towards health. Just a little bit about me. I started initially as a podiatrist and then went on to study psychology and communications. I have certificates in kinesiology, healing modalities, exercise science and sports restoration, health and nutrition from the UK, functional medicine from the United States, and my sub-studies include detoxification, hormones and sexual health, particularly insulin resistance, stroke, and genetics. Please read the disclaimer. It's important for you to note that all the information here is for information only, and it's not intended to replace a relationship with your medical doctor. So if you're going to be making any changes in your health, please discuss all your changes with your primary care practitioner. So what are the steps to health that we're going to discuss in this particular podcast? I'm going to do a brief introduction. We're going to have a look in more detail about what to remove in your life and what to add in your life that's going to take you towards healthy living. I'm going to look at one change. So if there's one thing that you can do, that you can fit into your life, that is going to have the greatest blanket impact, we're going to discuss that. In terms of the costs for health, there are a couple of gifts. So anybody who is wanting to take advantage of the free gifts, you can contact us, and I will send you a booklet on how to just help alleviate the costs for your health. And then we're going to have a look at where to get your supplements and any additional support. So what are the health challenges that we all have to experience? The first one, I think, is trust in the medical system. At the moment, there's a traditional medical model. So when we become unwell, if we develop any kind of a chronic condition, at the moment, our go-to is our medical doctor. And of course, in a situation, if we've had experience with the medical system, we may have had amazing experiences, but we may not have. And we may also want to add to our traditional medical experience additional steps that we can do ourselves that are going to take us faster towards health. We're going to have a look, as I say, in the handout, at the cost of care. We're going to look at potential side effects of treatment options, because the problem with treatment options, and that does include some natural options. Just because a treatment option is natural does not necessarily mean that it has no side effects. Allopathic medicine, all allopathic medicine has got side effects, and it's really a toss-up where we're looking at what are the benefits of the medication that we're on versus the side effects. And sometimes the side effects require more medication, and then that additional medication requires more medication, and we end up falling down into this rabbit hole where we're on 15 different types of allopathic meds. Ultimately, the liver has to clear that. They've all got side effects, and it's very difficult for us to know what we can dispense with and what is really important. So what do? We access the internet, and the internet is incredibly useful, but there's a lot of information on it. And if you're not in the medical field, if you obviously have another industry, how do you know what to believe on the internet and what is possibly misinformation or nonsensical? Now, so for most of us, we might be ignorant of the cause of our particular condition. We might have a name for it. So for example, we might be diagnosed with an autoimmune condition. Let's just say rheumatoid arthritis. The name that is given to our signs and symptoms is rheumatoid arthritis, but what is the root cause of that particular condition? And there is always a root cause. Or if we're looking at cancer, cancer is basically, it's a non-communicable disease. So cancer might have developed in our body from various causes. It might be what we eat, what toxins we're exposed to, how the body processes those toxins, what is our genetic makeup. All of these, and plus a whole lot of other factors, all contribute towards our diagnosis of non-communicable diseases. And most of the time, we have no idea what causes them, and we guess. Sometimes even we go to practitioners and they also don't know what causes it, and then they'll resort to guessing, or they'll just say, oh, well, you know what, it happens to some people. But there is always a cause. And very often, if one can find a practitioner, either a medical practitioner or a functional medicine practitioner, who can help you drill down a little bit to see what was the root cause of this particular condition. What were the steps over the years that led your body into this diagnosis? And if one can excavate that, you can go through the steps to undo that, and obviously that is going to help you heal quicker and heal more effectively. We need to allow time to heal. We forget that we might have a particular diagnosis. It was not an overnight diagnosis. It might have taken years for the body to slowly work towards that particular diagnosis. And then to expect the body to heal in a short space of time is unrealistic. So we need to consider the time to heal realistically so that our body can work step by step in the right direction. What's most important is personal responsibility. In our present medical model, we actually transfer the responsibility of our healing onto the practitioner. So if, for example, we've been diagnosed with cancer, we transfer that responsibility onto the oncologist, and we don't take personal responsibility. And taking personal responsibility, making changes, having a look at what were my habits that led me to this diagnosis. Obviously, if one can undo those, you're going to heal much faster, and any healing is going to be more effective. And any treatment is going to be more effective. Whether you decide to go down the route of more traditional medical treatment, or whether you're going on a more alternative route, that's going to be more effective if you take responsibility. The next issue is how much is enough? How much of whatever we are taking, whether or not it's an external medication or a supplement, how much of that is going to be enough? Because everything is dose dependent. So sometimes what happens is that we read somewhere on the internet that a particular treatment is going to be effective for, let's say, a cancer diagnosis. And the question is, well, how much must I take and how long must I take it for? And it's very, very difficult. Some of this information is not readily available on the internet, and it's quite hard to work out what is going to be right for your body. And everybody's different. Every person's weight is different. Every person's digestion is different. Every person's detoxification capacity is different. So there is no one size fits all that one can just pull off and apply it to ourselves. The other thing to consider is that there is a lot of misinformation on the internet, and the misinformation is on both sides of the coin. There's misinformation on traditional medical treatment, and that might be economically driven, and there's misinformation on alternative treatments as well. And it is understandable that for those of us who try to deal with any kind of a diagnosis, especially a severe diagnosis, it's very, very difficult to try and sieve out what's misinformation and what's not. The other thing to consider is often we look at monotherapies. And monotherapy, so for example, I'll use ivermectin as an example of a monotherapy. Let's say we've been diagnosed with cancer and you've seen on the internet that ivermectin now is starting to gain traction as a treatment for cancer. Now, if you just take ivermectin and you don't address the foundational reason as to why you developed cancer in the first place, that monotherapy as ivermectin is going to be less effective and possibly not effective at all. So we really need to look at the body as a whole and find out, how did you get to where you are now, and what are the therapies? And they're always layered, and usually there are multi-therapies that one has to take on: lifestyle changes, attitude changes, medication changes that one has to take on to go through the process of healing ourselves. And at this point, I do want to reiterate that it is very important for you to discuss changes with your medical doctor. So whatever is presented in this presentation, or anything that you hear on the internet or anecdotally from friends or relatives or people that you know, take that information and discuss it with your medical doctor. So when we're looking at causes of disease, there's an approach that we can take when we are looking at causes of disease. Sorry, let me just move this on. The first thing is we need to look at what are we doing that is causing the disease and what is obvious that we need to remove. So the first thing is our infections. So when you're looking at how the body is responding to a particular disease, we need to see am I infected with anything? So we've got the bacterial pathogens. This might be Lyme's or H. pylori. We've got viral pathogens. We've got fungal pathogens, so candida, molds, or mycotoxins. So, for example, if you live in a house where there's mold and you're breathing that mold in, it increases your risk of developing Alzheimer's, for example, and it increases your risk of developing cancers, never mind the lung problems. Parasitic pathogens. I'm sure you've probably picked up quite a bit about parasites and the impact that parasites can have. And invariably, we are almost all infected with some parasites. Normally, the immune system will manage it, but some parasites are very resistant. So then one has to do specific parasite cleansers to clear your body of that, because even if the parasites die, they exude a toxin. Now the body has to detoxify. Some things that a lot of people have are dental infections or problems with their teeth. And it's almost a primary to address dental infections, because if you've got infected teeth, of course your teeth are right near your head, and that increases your risk of developing Alzheimer's, for example. And it also increases your risk of developing cardiac issues. Adrenal stress. Stress is one of the very problematic causes of disease that's sometimes very hard to address, because for a lot of us, you, for example, might be in a job that you're very unhappy in. You might have, let's say, an elderly parent that you're caring for. You might have a handicapped child that you're caring for. These are stress situations that you cannot just dump. You have to cope with them. And then what happens is that you're dealing with the adrenal stress of your circumstances, and supporting your adrenals is going to help. And very often if you go to, let's say, a pharmacy, and you go and you look at the shelves of adrenal support, and you don't know, well, now which one must I choose? And adrenal stress is not that easy to address, because depending on how suboptimal your adrenals are functioning, your choice of adrenal support is dependent on that. The other thing is we don't realize that adrenal stress is triggered by lack of sleep. So if you're not sleeping well and you've got sleep apnea, that makes adrenals, they struggle harder. If you over-exercise, now we all know that exercise is very good for us, but if you are somebody who goes from one triathlon to another and you're over-exercising, the demand on the body starts to weaken the body, because it uses up your energy stores, which we call ATP. It uses them up too fast, and they're very important for the body to heal as well. So if you are depleting your energy stores, there's no reserve left over for your body to actually heal in just the normal breakdown that we have, protein breakdown that needs a nightly healing. So every time you heal at night, and then you wake up, and in the morning, your body is steps towards being stronger. If you're depleting your adrenal reserves, then that's actually not possible for the body to recover sufficiently from that. Of course, illness is a bit of a no-brainer. And the other thing that people don't realize causes a lot of adrenal stress are food sensitivities. So foods such as gluten is a big one. Dairy for some people, nuts. People are allergic to nuts, sometimes eggs, sometimes citrus. So certain people have food sensitivities. And if you've got food sensitivities, then it creates a fundamental stress in the body, and your adrenals have to deal with that stress. This one I'm not really going to go into great detail. Toxic emotions. So if you are dealing with deep-seated anger, guilt, fear, hostility, shame, any of these emotions, they create a toxic response in the body. And as a foundation, they need to go onto the list of issues that you need to get on top of in order to either heal your body if you already have a diagnosed condition, or to make sure that your body doesn't develop any kind of condition. So it's not nothing to have toxic emotions. It's important to be able to manage these. What about toxic stress created by our uneliminated hormones? Now, our hormones are really, really important. But if the hormones build up, now women will know this, if we've got estrogen, if we've got too much estrogen, and our body needs to clear that, so it's called estrogen dominance, then we tend to get belly fat. And not only that, estrogen dominance can predispose us towards getting the cancers such as breast cancer or endometrial cancer. So what we want with our hormones is we want our hormones to work well. And then when we're finished with it, our body must be able to excrete those. And sometimes a combination of our genetic makeup and kidneys and liver and whether or not we're constipated, our body's not eliminating hormones the way that it should. Heavy metals, we know that lead, cadmium, mercury. So if you smoke, for example, you're developing all the heavy metals that are in cigarettes. Sometimes if you've got mercury in your mouth, so you've got mercury fillings, the years of accumulation from heavy metals also predisposes us towards getting not only Alzheimer's, but also the conditions that are associated with toxicity like cancer, for example. Phthalates and parabens. Now, if you were now to just go and have a little look at your body cream and you read the ingredients at the back, almost invariably you'll see parabens, and parabens are petrochemicals. And we would never pour petrol into our hands and smooth that on our skin. But the creams and the shampoos and all of those body care products that we put on our skin contain phthalates and parabens. And phthalates are also estrogen mimickers. So men, for example, if you're exposed to phthalates, they mimic estrogen. And that's why in the old days, depression tended to be more of a female condition because of hormones. But now what's happening is with the xenoestrogens, in other words, the foreign estrogens that men are exposed to, not only on what they put on their skin, but also, if you were to consider this, water that's purified is purified from the point of view of viruses and bacteria, but not from the point of view of the eliminated medication and eliminated hormones that are coming from other people. And then we are drinking water that is, certainly it doesn't have bacteria in it, but it's not necessarily purified or distilled. And that's why to have water purifiers in your home it's a little bit of a no-brainer. So chlorination and pesticides, obviously as well, that's coming into the water. If you work on a farm or you live near a farm, you're exposed to the airborne pesticides, any volatile solvents, crazy things that we don't realize. So for example, if we've got shower curtains that are made from plastics, we get an off-gassing from these plastics that we breathe in. So you've got the warm shower going, the off-gassing that's coming off your shower curtain, you breathing that in. And each time it's a tiny amount, but over years they accumulate in the body if your body detoxification capacity is not working properly. So polychlorinated biphenyls, organophosphates, bisphenol A. So, for example, if you're drinking water from plastic bottles, BPS, even though it might say BPS free, they just replace it with another equally damaging agent. And you're drinking water from plastic bottles, and men especially, these are xenoestrogens, where you are now exposed to way too many estrogens for a male body. But women as well, we don't want to be exposed to excess estrogen because it accumulates in our estrogen-sensitive tissue, and we need to be able to clear that. And the halogens, so the halogens, if you look at the periodic table, the halogens are chlorine, fluorine, bromine, and iodine. Now, we need iodine. Iodine in small doses is very important for thyroid health. And thyroid helps our body in untold ways. Now, chlorine, fluorine, and bromine displace iodine, so they knock iodine out the body. And if we think about our water's all got chlorine in it, we use fluoride in our toothpaste and certain foodstuffs like tea, just ordinary tea is very high in fluoride. So we need to be cognizant of the fact that without even knowing it, we're ingesting fluoride. And bromine, I understand that they add bromide to bread to prolong the shelf life. So if you are somebody who eats bread, never mind the fact that gluten is not the best for our gut, we of course are we taking in bromide from the bread. So I spoke about gluten in the gut. The gut it's really the first line where our body is exposed to agents that might not be healthy. And the result is gastrointestinal stress, where we get a dysbiosis. So, for example, we might have dysbiotic gut bugs, where we have a preponderance of pro-inflammatory gut bugs and too little anti-inflammatory gut bugs. We might have some gut bugs that are actually disease-causing. With a dysbiosis and with certain foods, so for example, gluten triggers a secretion of a compound that we have in our cells called zonulin, and zonulin opens up the gut junctions. So what is now in our gut seeps through the gut into the bloodstream. And this leaky gut or increased intestinal permeability means that the bacteria and the partially digested food that is in the gut now seeps across into the bloodstream. Our immune system is not used to seeing this. Our immune system reacts to what it perceives as foreign agents. Our immune system goes up and our inflammatory process goes up. This predisposes us towards getting autoimmune conditions. So healing our gut is very, very important. We might have hypochlorhydria, and this is too little stomach acid. If you're on proton pump inhibitors or you're on any of these antacids, it means then we have too little stomach acid and you've got incomplete protein digestion, or our food generally, the nutrients are not being digested because we've got too little stomach acid. And then slowly over time, for example, let's say you're on proton pump inhibitors, you might be having a calcium supplement, but the supplement is just, your body's not able to absorb it. And then over the years, you develop osteopenia and then osteoporosis because the nutrients are not being absorbed. Secondly, with gastrointestinal stress, it's triggered by food allergies, so gluten, dairy, all those food allergies that I mentioned. And even though you can test for these, so you can test for IgE, IgM, IgG, you can test for all of those. But for a lot of us, the testing is very, very expensive. And the best way is actually to do what we call an elimination diet. You actually eliminate all the potential foods that could be causing allergies for about 8 weeks. And then you slowly introduce them and you see how the body responds. It's not the easiest way of investigating this, but it allows us, especially if you've been diagnosed with any alarming condition, it's important to address what's happening with your gut. And gluten, gliadin, celiac, all of those, even though you may not be celiac, in other words, you're not allergic to gluten, you might still be gluten sensitive, and the body is still producing more immunoglobulins, and that's reacting to the gluten, and the gluten is also damaging the very fine gut lining and causing this leaky gut, which triggers the immune response. And of course, every time the immune response is triggered, your inflammatory process will go up as well. Inflammatory foods. So the inflammatory foods, grains, dairy, nightshades. So nightshades, for example, are foods like tomato or brinjals, white potato, they're nightshades. And some people are sensitive to oxalates or to nightshades or to salicylates or to lectins. These are all toxins that are held in vegetables. So we think vegetables are very, very good for us. And we might have these power smoothies that have got spinach and kale and all of these things in your power smoothie. And you might be sensitive to the plant toxins. And not only then, if you're sensitive to plant toxins, do these plants produce anti-nutrients? In other words, they block the absorption of important nutrients like calcium, for example, but they increase your body's inflammatory response. And again, one can test for these. And obviously, a practitioner will be able to look at your symptoms and make a decision based on the symptoms that you are experiencing, and be able to tell you, okay, it looks like there's a possibility that you are lectin sensitive or you oxalate sensitive. And then one has to eliminate those. And then you, again, once you've cleared them from your system, you try and introduce them again. It takes time, but it's a more cost-effective option than going for the tests. In South Africa, where I am, The tests need to be sent overseas, so they're very, very expensive. Secondly, junk foods. We all know we shouldn't be eating junk food. So trans fat and processed carbs. If you've been diagnosed, to eliminate those entirely from your diet will be very helpful towards taking you towards health. So if you've not eliminated these, so if you are carrying on with your normal diet, and let's say again, for example, let's say you've been diagnosed with cancer and you are thinking that if you take fenbendazole or you take ivermectin or you take bicarb or you go onto any of these more alternative treatments and you think that it's like a silver bullet, it's going to heal you, and you're not addressing any of this, then your success rate is going to be very, very small. So the PUFAs, that's soy, corn, safflower, canola, cottonseed, sunflower seed, all of these are very pro-inflammatory. It is far better when you're using oils to use saturated fats than it is butter, for example, or ghee, than it is to use these seed oils. The seed oils, the process of actually creating these seed oils that you buy off the shelf, where they're deodorizing them and they are degumming them and they're stopping them from smelling. There's so many toxins and so many chemicals that are going into it that it's almost a toxic soup that you're adding if you've got either processed foods where they use these or you are cooking in those. And then, of course, the obvious things like sugar, alcohol, tobacco, vaping, all of these introduce toxins into your system that you need to clear out so that your immune system, your inflammatory process, can focus fully on your condition and towards healing your body without having to spread the healing process by just trying to eliminate all the toxins that we're taking in. So that, of course, leads us into poor detoxification, because if you've been diagnosed with a condition, especially conditions that are bedded in toxins, if your body's not detoxifying well, you're going to struggle to get well. Methylation plays a role, and methylation is very complex. Some people have genetically, they have poor methylation. Now, a methyl group is a carbon with 3 hydrogens attached to it. And for example, let's say you have got breast cancer and you're wanting to eliminate estrogen. For your body to actually get rid of the estrogen, it needs a methyl group to attach to it. So if you are a poor methylator, then you need to look at your methylation from other aspects. And you can actually get specially treated vitamin Bs, for example, that have a methyl group attached to them. But again, all of these things, they all cost money, and you want to be very specific about your choices rather than a hit and miss view to taking beneficial supplements. Glutathione. So glutathione is our master antioxidant. Again, genetically, some people have problems with their glutathione manufacture. Superoxide dismutase is another genetic issue. Superoxide dismutase also helps our body to manage hydrogen peroxide. So these are very strong players in our body's ability to detoxify. The ones we can manage are you constipated? It's something, it's on that list of tick it off. If you think you're going to help your body towards health, make sure that you're not constipated. If you don't sweat, usually people who don't sweat have got problems with their thyroid, so that needs to be addressed, and obviously a high toxin intake. So if you're smoking, or you're drinking a lot, or you are living next to a highway, or you are, for example, people who swim and they're swimming regularly in chlorinated pools, it might be a problem for them. And these are small things. It seems like nothing, but every single small exposure that we have that we can change will take us one step towards health. And cumulatively, all of these small steps add up, and they add up to an impact that is very beneficial. Now, the bioenergetic blocks, this is not something I'm really going to go into detail in this particular talk, because you're looking at how your body lines up, how your spine lines up, how the separate bones in your skull line up, your meridians, your chakras, any electromagnetic pollution. This is becoming a huge, huge problem with all the G5 towers that are going up. And unfortunately, we have no control over this. Our cell phones, how we use our cell phones. Do you sleep with your cell phone underneath your pillow right near your head and not on flight mode? Do you carry your cell phone on your hip right next to your reproductive organs? They're small things, but they're habits that we're getting into that are deleterious to our health and, of course, our mental state. Now, this is something that is not generally addressed, iatrogenic causes of illness or disease. Now, iatrogenic means this is illness caused by medical intervention. Medical intervention that is both correctly applied and incorrectly applied. So they're not necessarily mistakes, but nonetheless it comes from medical intervention. So this might be medications. Now, the studies that are done, usually the double-blind studies that are done on medicines, they will do a double-blind study on that medicine as a sole medicine. In other words, on its own. So let's say, for example, your doctor says you have high cholesterol and he wants to put you on a statin. The studies that are done are with study subjects who are just on that statin, but that almost never happens in real life. In real life, you might be on a blood pressure lowering pill, you might be on pills for diabetes, you might be on a statin, you might get migraines. So let's say, for example, you're on a medication for migraines, and no studies address the combination, what we call the polypharmacy, that comes with the illnesses as we get older. Unnecessary surgery. So, for example, let's say you've got a back problem. You go to your doctor, either your neurosurgeon or perhaps your orthopedic surgeon, and they speak about the surgery. They don't talk to you about the risks. Or let's say, for example, you have colon cancer running in your family, and your doctor will say to you, you need to have a colonoscopy. They don't discuss with you the fact that you may react to the sterilants that they use to sterilize the instruments that they are going to be inserting into you. There are perforations, so sometimes they might perforate your gut. It might be a small percent, it might be 1 or 2%, which is fine if you are the 98%, not fine at all if you're the 1 or 2%. And then one needs to weigh up, do I really need this intervention? What are the risks? And almost never. I mean, have you ever sat in front of a doctor and asked him, how many of these have you done? And he said, well, you're my first. And that's just never going to happen. So it is a problem because we cannot believe what we read and we cannot believe what we are told. Hospitalizations. How many of us know people who've gone into hospital, they've picked up some airborne infection in the hospital, and they either don't come out or they've got complications in that hospital and they stay in that hospital. And sometimes the complications, when they come out, their life is blighted for whatever reason. And of course, the obvious ones would be the medical mistakes. And the thing is, there's so much information out there. It is unreasonable to think that your doctor in front of you knows everything about everything. Even in his specialization, they don't know everything. And very often you will ask and they might dismiss it. So for example, for people who've maybe looking at alternative therapies for a cancer diagnosis, if you speak to your oncologist about alternative theories, very few of them will say to you, well, you know what, it's definitely worth a try. Or, perhaps if you do this in addition to this, they almost never do that. And it leaves you very isolated. It leaves you trying to do things for yourself with a sea of information that you don't know who to believe, a doctor who you want to trust, who is not helping you in these particular, very often drugs, we call them repurposed drugs. So very often drugs, for example, like propranolol. Propranolol is a drug that's been on the market for years and years and years. It's got a very high safety margin and it shows benefits in treating cancer. Aspirin shows benefits in treating cancer. If you ask your oncologist about it, he may not know about it. Then it's up to you to investigate it. But how do you do that if you don't even know where to start? So it's very challenging for patients when they are dealing with the fear and anxiety of a diagnosis that might be life-threatening. And what questions do you ask, and who do you believe, and do you believe the information that you're exposed to on the site? It is very challenging. And of course, basic no-brainers, polluted air and polluted water. Of course, we know that if we are drinking polluted water, that could over time lead to kidney problems, liver problems, then your body's not detoxifying properly. Your body burden, we call it the body burden, which basically means there are so many external factors that your body has to deal with, that eventually, instead of your body working with a surveillance system where normally, again, I'm going to use cancer as an example, we all have little pockets of undifferentiated cells that could be called cancer cells. But normally our immune system, it basically travels around the body and you get this surveillance system, and then it will attack those little pockets of undifferentiated cells before it becomes a problem. If your surveillance system is busy dealing with the body burden, it's not concentrating on dealing with smaller issues that could then develop into major problems. And structural imbalances. So, for example, because pain, let's say, for example, you've got a structural imbalance with your spine. You need to address that, because if you are in chronic pain, and it might be from a structural cause, if you're in chronic pain, you've got the psychological aspect of the pain, you've got the physical aspect of the pain, and you've got the cellular aspect where your body's inflammatory process is triggered. And when your body's inflammatory process is triggered, it predisposes us towards getting non-communicable conditions. So, cardiac issues are bedded in inflammation. Stroke is bedded in inflammation. Alzheimer's, cancer, even osteoporosis, those issues are bedded in inflammation. So addressing that is important. Okay, so we're going to look at now, we've looked at what to remove. Now we're going to look at what to add that's going to take you towards health. Okay, so in terms of what to add, the basics. And everybody will, of course, you're going to think this is a no-brainer, but sometimes this just helps remind one. Water. So you want a spring water, but not spring water that you've bought, because spring water that you bought, sometimes the supplier it's not necessarily clean water. It's always best to invest in a water filter as if this is the first thing you get, a water filter for yourself, and you're going to filter your water. You want restorative sleep. So restorative sleep, you're looking at good quality sleep for approximately 7 to 9 hours really is the range of beneficial sleep. Exercise. Now I speak about restorative exercise. Restorative exercise is exercise that doesn't exhaust you and deplete your resources. It gets the blood pumping. It slightly raises your heart rate. You're out in the fresh air. You're getting some sunlight, or even at the gym. But it's enough to raise your heart rate, but not tire you. You need to practice mindfulness. So that would be obviously create a situation where you're managing your stress and you've got peace of mind. Nutrient-dense food, and of course I've mentioned sunlight. Sunlight is so important. And South Africa, we live in this beautiful country where there's wonderful sunlight. There's, we might have a week of rain, but most of the time we need to get out into the sunlight. And getting out in the sunlight, the best approach, especially if you want to address restorative sleep, is you get out into the sunlight round between 10 and 11. You spend maybe 10 minutes directly in the sunlight, no sunglasses on. Allow the light to enter your eyes. Even if you close your eyes and you turn your face towards the sun so you can feel that warmth on your eyelids, and preferably with as little clothing on as you can possibly manage. Obviously, depending on where you are. If you're at the office, that's not going to be ideal. When you look at nutrient essentials, if we don't eat good food, as a functional medicine practitioner, we look at the interplay between what you eat that you shouldn't, what you don't eat that you should, your exercise, your stress, your genetics, and how that relates to chronic diseases. So when you're looking at the nutrients, the food that is coming in, the first thing is that you need good digestive enzymes so your body can actually break down the food and absorb it. And then when you're looking at health issues can be brought about by fatty acid deficiencies, amino acid deficiencies, in other words, not enough protein. The older we get, the more protein we need to repair, and very often the harder protein is to digest. And then one needs digestive enzymes, and they're very, very helpful to help the body extract the nutrients from the food. We need cofactors. So, for example, vitamins work with enzymes to help our body develop metabolic processes. So the cofactors are vitamins, but also minerals. So we need a combination of vitamins and minerals. If we have enzyme deficiencies, you're not going to be able to digest the food. Mineral deficiencies I mentioned, and of course vitamin deficiencies, and all of these together help the body to absorb the nutrients that we need to either prevent ourselves from becoming ill or to help our body to heal. Because if you are ill with any condition and you wanting your body to heal and your body doesn't have the raw material to repair, then your healing process is not going to go according to plan. If we look at a deeper dive into health, we want our hormones to be balanced. Cortisol is associated with our stress response, so we need cortisol balance and stress balance. Our DHEA, estradiol, estriol, estrone, melatonin, progesterone, and testosterone, sorry about the spelling mistake there, all of those in terms of our hormones, those need to be balanced. We need to look at our immunoglobulins. We need mitochondrial cofactors, and the vitamin Bs generally are our mitochondrial cofactors. Now, for those of you who don't know what a mitochondria is an organelle that is, we've got many, many millions of them in our cells, and they are like the factory that makes our energy. So our energy currency is called ATP, adenosine triphosphate, and it is our mitochondria that make ATP. Now, for our mitochondria to be healthy, they need cofactors, especially the vitamin Bs. So that's very important. So if you're not eating food, for example, liver is very high in vitamin B, and those of you who would rather stick needles in your eyes than eat liver, then you need to consider taking vitamin Bs as a supplement. And these are targeted supplements. They're not just because some vitamin Bs are better than others. And it's important to find out which are the right vitamin Bs for you and the right doses for you. Because again, if you go and you buy vitamin Bs off the shelf, Neurobion is a good example. Neurobion has got very, very small doses of vitamin B in it. They don't even touch sides. So if you've got problems with your mitochondria and you have low energy, taking Neurobion is not helpful at all. One wants to look at factors that help detoxify us. We want to look at something that's going to balance our intestinal flora, so probiotics. Sometimes you don't want to necessarily buy a probiotic off the shelf. You can make your own probiotics using scobies and kefir and agents like that. Our methylation cofactors, this is also not only like our mitochondria, but our methylation cofactors are the vitamin Bs as well. I addressed methylation a little bit earlier. Glutathione, whether our body can make glutathione is important. Glutathione, unfortunately, is one of those supplements that's not readily absorbed. So if your body struggles to make it, sometimes it is one of those items that, depending on what your budget is, if you have and limitless budget, then to do glutathione injections or take glutathione supplement, one can afford it. But if not, then one needs to structure. So you've got certain agents that might be a priority rather than taking glutathione supplements. You need to heal the mucosa, so in other words, heal the gut. That means removing certain foods, gluten, possibly dairy in some cases. We also want a mental state, a balanced mental state. In other words, our neurotransmitters, they are the chemicals in our brain that help us to feel good, help us to be motivated, help us to promote action. So, for example, those would be serotonin or dopamine or adrenaline or noradrenaline. These are all examples of neurotransmitters. And if our neurotransmitters are out of balance, then we may have depression or we poorly motivated, and it's hard to address our health when our neurotransmitters are not balanced. And then, of course, genetically, a gene profile is extremely useful, but the price nowadays is approximately between 5,000 and 6,000 rand to get your genes profiled. So if one has the budget for it, it's very helpful. If one doesn't, one can still work with so much in terms of health without getting the genes profiled. So it isn't essential, but it's one of the little ticks that we can tick off if we are trying to take steps towards health. Okay, so let's look at, if you were going to make one change, this would be the change that you're going to make. Most of us have sugar dysregulation. And sugar dysregulation contributes to many of the covert diseases, those that we maybe are not diagnosed. For example, something like regular migraines or, gut problems or constipation or joint pain. These are all the more covert type problems. They hide a bit, often triggered by sugar dysregulation, and some of the overt ones. So in other words, cancer is an obligate sugar metabolizer. Cancer's primary fuel is sugar. So if you've been diagnosed with cancer and you carry on eating a high sugar diet, or if your oncologist says, you can have Ensure. Ensure is extremely high in sugar. It will not benefit you at all to go that route. If you address sugar dysregulation, it's very easy to address. When I say easy, the tools to address it are very accessible. It's not easy in the sense that they are habits that we need to break, but with education and motivation, one can address sugar dysregulation. And addressing sugar dysregulation will help lots of issues. It helps your brain, so your neurotransmitters. It helps your joints. It helps inflammatory process. It helps muscle pains. It helps gut issues. It helps your immunity. Just addressing sugar dysregulation. So if you do one change, it has a very, very big impact as far as health is concerned. So the question is, do you have sugar dysregulation? And are these signs and symptoms, do they reflect what you experience? Do you have belly fat? Do you have mid-afternoon energy slumps? You get over lunch and then by 2 or 3 o'clock, you just want to put your head on your desk and go to sleep. You're very sleepy after meals. You have low blood sugar, so in other words, hypoglycemia. Sometimes even after you eat, you get those slightly shaky drops in your blood sugar. You're hungry soon after eating. You have nighttime food cravings where you're wandering downstairs and you've got your head in the fridge. You've been diagnosed with elevated HbA1c. Now, the optimal HbA1c is 4 to 5%. The margins are very tight. In other words, if you've got HbA1c and it's 5.6, your GP might be happy with that, but you are heading towards prediabetes with an HbA1c of 5.6. And it's best to then address your sugar dysregulation at that point. If you've got elevated fasting insulin, now fasting insulin is not regularly checked, and yet it should be, because it is the best test to see how your body's managing the sugars. Optimal is less than 5. Sometimes patients have got up to 19. If you have mood swings, are you anxious? Do you have depression? All of these indicate neurotransmitter imbalances, and neurotransmitter imbalances are closely associated with sugar dysregulation. So if you have answered yes to any of those questions, then good chance you do have sugar dysregulation. Now, the thing with sugar dysregulation, it leads to insulin resistance, and prolonged insulin resistance can lead to diabetes. Now, one can be insulin resistant for 15 to 20 years, where you're going regularly and having your blood sugar checked at your GP. So your blood sugar can be normal for 15 years, and yet you are still insulin resistant. And that's why I'm going to explain which tests you need to go for, but that's why it's very important to check fasting insulin and HbA1c and not just fasting blood sugar. Insulin resistance is associated with obesity, with metabolic syndrome, cardiovascular disease, cancers, type 2 diabetes, mood disturbances, as I've mentioned, low motivation, memory problems, poor concentration, and dementia, all associated with sugar dysregulation. Alzheimer's associated with sugar dysregulation. So what happens with our sugars is carbohydrates stimulate insulin. So whenever we take in carbohydrates, we're eating carbohydrates. And carbohydrates are not just the starches. All vegetables are carbohydrates. You've got your proteins, which are your various meats. You've got your fats, so you've got your saturated fats, you've got avocado, you've got those fats, and then your carbs are rice, pasta, breads, butternut, beetroot, even all your green ones are still carbohydrates. Now, depending on the type of carb will depend on how quickly that carb will stimulate insulin. if it's a high glycemic carb, it will stimulate insulin really quickly. Now, if you're constantly exposing your body to carbs and you're constantly flooding out, your pancreas is constantly flooding out insulin, this is what leads to insulin resistance. And it's a little bit like, eventually if you've got a child and you're nagging the child all the time, the child just switches off. The body is the same. If the cell is constantly bathed in insulin, the receptors become less sensitive, and this is called insulin resistance. So insulin is a hormone. So hormones are messengers. They go around the body and they tell the body what to do. It's formed in the pancreas, and its job is to transport glucose into the cell using insulin receptors. So if, for example, you eat something, you've now got glucose in your blood, the pancreas secretes insulin. The insulin picks up the glucose from the blood and it takes it to the cell wall. And through the insulin receptors, the insulin locks onto the cell, and the glucose is transferred from the blood into the cell, and then the mitochondria can pick it up and make your ATP. But the message, insulin is a messenger. It tells the body to store energy. It's a growth hormone. It tells the body to grow. That's why insulin is a player in cancer, because it's a growth hormone. And cancer, of course, you don't want the cancers to grow. Any carbohydrate will trigger insulin. Obviously, at sometimes it's delayed. So, for example, if you eat a meal that's got fat and it's got protein, and it will slow the trigger of insulin. Excess insulin tells the body to store glucose as fatty acids. So excess insulin makes you fat. And that's why if one is diabetic, if you type 2 diabetes is a condition that is triggered by too much insulin, till eventually what's happening is the pancreas is pumping out so much insulin. It's a little bit like sitting in your car and revving your car engine without going anywhere. Eventually you're going to burn your engine out. Eventually you'll burn your pancreas out. And then one converts from having agents like glucophage or metformin and to needing insulin because you've burnt your pancreas out. And the minute one converts and you go onto insulin, patients will gain weight. The other thing, insulin does assist in protein and fat metabolism. So some insulin is important, but not too much. So if you're going to do small changes that are going to have a big impact, you need to cut out carbs. And by carbs, I'm not saying cut out your fresh veggies or fresh salads. I'm talking about no bread, no potato, no rice, no pasta. All of those very starchy carbs. Your body does not need them. Unless you are a child or you are an athlete, and a very, very high intensity athlete, your body does not need those carbs. You also need to eat 2 to 3 meals a day and not eat regularly. Now, there is a school of thought that says to balance your insulin, you need 5 or 6 more meals a day. It does balance insulin, but it balances the presence of insulin in the body. And as long as there's insulin in the body, your body gets the message to store energy. So if you do 2 to 3 bigger meals and you've got gaps between those meals, there are times in your body where there's no insulin. Your pancreas is not secreting any insulin because there's no trigger for it. Then the pancreas secretes a hormone called glucagon, and glucagon is the fat burning one. Glucagon is the messenger that tells the body to burn fats. Another small change that creates a big impact is intermittent fasting. You want to exercise because when you exercise, you reduce the stored glycogen. So glycogen is another name for stored sugar in the muscles. And then when you eat, there's almost like a storage, a repository that the body can then put the sugar back into the muscle, because your body will burn the glycogen directly from the muscle if you exercise. You need to get proper sleep, because when you're stressed and you're not sleeping, it leads to insulin resistance. And you need to see, what is my state at the moment? So regardless of the condition that you may be suffering from, you need to get some baseline tests, and I'll talk to you about those now. So what happens with a stress response, when you're stressed, and it might be, you might get an acute stress, in other words, you're walking and a dog runs out and tries to attack you and you're going to run away and you get an immediate cortisol and adrenaline dump in the blood, that would be an acute stress response, but then the body will drain that. If, however, you have chronic stress and your body is constantly exposed to adrenaline and cortisol, let's say, for example, the examples I gave before, perhaps you have an elderly parent who is ill living with you, or you've got a handicapped child, or you've got maybe a boss, a job that you're very unhappy with. That constant exposure to cortisol creates in your body a chronic fight or flight response. And when your body's in fight or flight response, it triggers a dump of the glucose that is stored in the muscles into the blood. So effectively what happens is it creates a little snack in your blood. Of course, it then is going to trigger insulin because the body's not sure, you know what, this person is stressed. Are they going to have to fight or are they going to have to run away? So it needs an energy source to deal with that stress. But of course, if you're chronically stressed, you have a constant dumping of the glucose into the blood. And every time there's glucose in the blood, insulin's going to go up, and then you get the associated problems with insulin. And with insulin, your body's going to store fat. So when you're stressed, it's very difficult to lose weight if you're stressed. So dealing with stress as a primary when you are wanting to lose weight or when you are dealing with chronic conditions, it's very important to do that because this constant exposure to insulin creates that insulin resistance. Now, if you're looking at the cost of health, it's important to be specific. Don't guess, because how many times have we all thought, I need this? You go to a pharmacy or Dis-Chem or whatever, and you look and you think, okay, yeah, I'm going to buy that. Then you take it, you maybe take a week of it, and you've got another 180 in the bottle, and they sit on your shelf, and 2 years later, they're still on your shelf. That's why it's very important to just don't guess the supplements that you need. Find out where your status is now, and be very specific. Addressing your diet and your lifestyle needs to be done first. Addressing sleep and sunlight needs to be done first before you start on supplements or unless they are life-saving allopathic meds. If you don't address diet and lifestyle, then whatever you take in externally is not going to hold because the foundation, it's like building a house on marshy ground. Your foundations just don't hold. So you need lovely firm foundations, and then you can build the house above those firm foundations. You know, we often think that being healthy is very expensive, but it's all about reallocating money. So sometimes, for example, we might allocate money to that latte in the morning when we go to the office. And it is lovely to have, but if you're unwell, one can allocate money, and it's amazing how much a small reallocation of money can add up to being able to spend money on supplements, for example, that are targeted and specific and beneficial for you. You can grow superfoods on your windowsill. You don't need a big garden. You can just get these little plant pots and you can grow superfoods on your windowsill. And I've said before, it's very difficult to know what to believe. So it is important to maintain an element of skepticism. And actually, the rule is really don't believe anybody. Do your own due diligence, do your own homework. And if somebody gives you advice, think, does this make sense? How is this going to help you? Ask questions without just accepting what you're told. And that includes any doctor or specialist that you go to. Prepare your questions in advance so that you can ask them. And, if they are unwilling to take the time to give you answers, find a new one, because then one forgets that our practitioners are service providers. In the same way that getting our car serviced at our mechanic is a service provider. Our practitioners are service providers, and we pay for that. And we need to be able to walk out of that consultation feeling that all your questions have been answered. Service your body every 1 to 2 years. We service our car. We service our car once a year, but we don't service our body. And we need to find out what is going on clinically in the body. And there are certain lab tests that are obviously more beneficial in the sense they give one a better idea of what's going on, like a complete blood count, for example. A complete blood count, a CBC, is very helpful if you're very sick or you're in hospital. It's very helpful. But to see where you stand in terms of non-communicable diseases, it's not actually very helpful. And as I've said before, getting your glucose, fasting glucose checked isn't very helpful. It can be a waste of money. Rather, dispense with the fasting glucose and rather go for fasting insulin. And of course, if one is hit and miss, it does create expensive urine. But expensive urine is not only about the supplements. Yes, if you take supplements that are unnecessary, or you've not created a foundation of health with your attitude, your exercise, your stress, and what you eat, then you can take supplements and they're not going to impact greatly in your body. And then it is expensive urine. But in the same way, your doctor might say to you, okay, well, you've got high cholesterol, I'm going to give you a statin. If you've not addressed all the other factors that affect inflammation, for example, then your risk of cardiac events is not diminished by just taking a statin if you don't address all the other issues. So this is a list of the tests that are important, your HbA1c and your fasting. I've put fasting blood sugar here, but depends on your budget. So HbA1c, fasting insulin, very, very important. Vitamin D for your immune system. Vitamin D is one of those levels that it's not an expensive test. And even though we live in South Africa, most of us are deficient in vitamin D, and the benefits are huge. High sensitive C-reactive protein looks at your body's baseline inflammation. It's not foolproof because we have other inflammatory markers, but it's good as a baseline test. If you can address genetics, that's wonderful. Uric acid is very important. If you've got high uric acid, it increases your risks of developing Alzheimer's and dementia and cardiac events. Homocysteine, the same. If you've got high homocysteine, increase your risk of cardiac events and Alzheimer's. And ferritin is very important, especially for men and menopausal women, because if you allow your ferritin to go up, it works like iron filings. You've got all this iron in your blood and it can deposit in your organs. So you need to check your ferritin. If you're young, obviously you're a young woman and you've got periods, your body's clearing that ferritin. But menopausal and men, you want your ferritin to be checked, because it's so easy to address it. If you've got high ferritin, you just go and donate blood. Very, very easy to check that. What about product? So with product, when you're buying product, you need to be confident that your product is pure. You want cost effective. So cost effective is not only about being very specific with the products that you choose, but it's also about knowing that the supplier is not overcharging. You want availability. You want to be able to get it, not buy something that's obscure and then just now it's now no longer available. And as I've said, you need to be specific. So you can get product at health shops. You can buy it online. Please do not buy from Amazon. There are lots of counterfeit products on Amazon and you would not know the difference. Health shops and Dis-Chem. Alternatively, you can go to Bev at Free Essentials. Bev is my go-to. Now, I have no financial gain recommending Bev, but the products are pure, the products are cost effective, they're readily available, and then with certain guidance, you can either get some guidance from Bev or you can get some guidance from functional medicine practitioner, and you can get your products from a reputable source. Thank you very much for your time and your attention. If you need to contact me, you can either email me on health@livetoa100.co.za. You can go to my website, or I didn't put it on here, or my cell phone number for a WhatsApp is 084 770 5943.